Hello, I'm Sean Park, prosthetic urologist practicing in Seoul, South Korea. Today I want to talk about recent my visit to the Mayo Clinic. Mayo Clinic in Rochester, they have a great men's health team. The leader for there is Tobias Kohler, Matt Jigelman, and Svan Hilo. Both three of them are full consultants at the Mayo Clinic, and that department is where I wanted to go. I have always heard a lot of good things about the Mayo Clinic. There is a hospital ranking, reports every year in the U.S., and the Mayo Clinic has always been number one in the U.S. Especially for the men's health, I saw that they are doing really great. Their results are really superb in terms of the research and the clinical research and training as well. So residents or fellows who have been with their training systems, they're really happy, and they become a really successful urologist all throughout the field. So with those reasons, I went to the Mayo Clinic to see some IPP cases and how they treat the BPH patients. I was able to experience their system as well. In the Monday morning, they had a grand round, and the residents were coming out preparing their exam at the same time, like the oral exam later for their boardship, and then they were presenting, and the professors were pitching in, and they're getting education right on site. Outpatients, clinics, residents were dealing with the patients as well, and the advanced practitioner providers, specialized nurses, were helping out the patients, and it was just super efficient and then lovely. So they had a full floor, devised only for the urology department, men's health department. They can take care of the patients without moving further away. I was sitting into the outpatients consultations and went to their OR, hanging out with their journal clubs, and all those activities made me, wow, what a joy they have. For that, it was a short trip, but what I felt is that they built a small ecosystem within there, so that the doctors can do their practice and the training and the research with the way they want. City itself, like I said, is very boring, which means that it has a really less, distractions, so that they can really focus on their work. It's not really monetary drive they work for, but more of a pure joy toward their jobs. Not just the professors, also residents and nurses most of them have the same interest into what they're doing. It is not, I believe, not a bad idea how to make your practice better by learning from the others. Actually, that is the way that we surgeons can train ourselves with our surgeries. Because if you just watch your own surgeries, you can't really make it better. Maybe slow and the slight progresses over the time, but if you compare and learn from the others, you can objectively watch your surgeries. Learning from the other institutions is the same way. Is there anything I can do better in terms of my practice management, or in terms of the staff education? Is there anything I can do better in terms of the patient care or the setting of my practice? All those things, I believe, we can always do better by learning from the others. And in regards of that, I think I was really lucky to be at the Mayo Clinic. All in all, I was very happy, and I'll try to find out how to make a more, collaboration and work with the Mayo Clinic staffs, especially Dr. Kohler, Dr. Jigelman, and lastly, Dr. Hilo. So I'm really excited with their visit, and hopefully we could do more, collaboration in the future.